How does influenza cause bacterial pneumonia? Imagine catching the flu and then suddenly feeling much worse with a deep cough, chest pain, and difficulty breathing. This can happen because influenza can lead to bacterial pneumonia, a serious complication. So how does this happen? When influenza infects the respiratory system, it first targets the cells lining the airways. These cells act as a barrier, protecting the lungs from bacteria. The flu virus infects and destroys these cells, causing them to die. This destruction exposes the underlying tissue, making it easier for bacteria to invade and settle in the lungs. Influenza also messes up the lungs' natural cleaning system, called mucociliary clearance. Normally, tiny hair-like structures called cilia move mucus, along with bacteria and debris, out of the airways. When the virus damages these cilia, bacteria like Streptococcus pneumoniae can build up quickly. The immune system's first responders, such as alveolar macrophages and neutrophils, also become less effective after influenza infection. These cells usually swallow and destroy bacteria, but the virus impairs their function, leaving the lungs more vulnerable to bacterial invasion. In addition, influenza changes how lung cells express certain proteins on their surface. For example, after infection, lung cells display a protein called GP96, which bacteria like pneumococcus use to stick to the lung tissue. This increased adherence helps bacteria colonize the lungs more easily. The infection also triggers an inflammatory response, releasing cytokines like IL-10 and type I interferons. While these help fight the virus, they can also suppress the immune response against bacteria, making it harder for the body to fight off secondary infections. All these factors work together to create a perfect storm. The damage to airway cells, impaired clearance of bacteria, weakened immune defenses, increased bacterial sticking, and a disrupted inflammatory environment all make it easier for bacteria to invade the lungs after influenza. This is why bacterial pneumonia often occurs during or shortly after the flu, leading to more severe illness and sometimes even death. It's important to remember that preventing influenza with vaccines and practicing good hygiene can significantly reduce the risk of developing bacterial pneumonia. If you experience symptoms like chest pain, difficulty breathing, or a persistent cough after the flu, seeking medical advice is crucial to get proper treatment and care.